Hello, and welcome to Medicare 101. We're going to take a minute or so to let everyone get logged in and make sure that they're ready to start today's presentation. I'll be with you today for about 30 or 40 minutes and just some housekeeping items as we're getting prepared for today's workshop. If you don't already, you're going to want to grab some paper to take some notes. That way you can write down any pertinent information or any questions you have. And that way we can make sure that you have a really solid foundation. My goal for you as you log off today is that you end up having a lot more understanding and knowledge about Medicare and your Medicare choices. If you haven't already, just for joining today, you'll be getting a copy of our Medicare and retirement planning book called 64 Plus, which was a #1 bestseller. So if you haven't gotten a copy of this already, please reach out and ask us for one, and we'll get you a digital copy at no cost to you. If you're turning 65 or needing Medicare information, you're in the right place. We're going to go over everything Medicare today, and my goal is for you to walk away here with clarity and understanding of exactly what is the right plan for you. And one more thing, if you need to run or can't stay for the whole presentation, I get it, no problem. There should be a calendar below or a link or an opportunity to book a one-on-one appointment to be able to speak with either myself or one of my team members, and that way we can get all of your questions answered. So without further ado, let's get started. First and foremost, you may be wondering who I am. A lot of you might have found me through social media platform, or maybe someone referred you to our online seminar. My name is Nicole Bonnekamp, and I'm a proud mom to my 11-year-old daughter, Riley. She's my world, and she's why I do what I do. She's why I get out of bed every day. I am the owner of Bonnekamp Senior Solutions, and I've been in the Medicare business since 2012. And I'm a co-author of the #1 best-selling book, 64 Plus, Your Ultimate Guide to Medicare and Retirement Planning. A little bit about our team. We're located in the Houston area, but we work the whole state of Texas and Louisiana, and we're continuing to add more states. We've got 5-star reviews on both Google and Facebook. We offer in-person learning at various areas around Houston, and we also help clients throughout Texas and Louisiana virtually and over the phone. You'll see Heather on the left and Kim on the right of me in this picture. You'll most likely be talking to these ladies as well when you work with us. We are really passionate about what we do. We look at everyone as an individual and offer recommendations based upon everyone's individual needs. There is no one size fits all, no perfect plan or option. They all have their pros and their cons, and we prioritize what's most important to you when we make our recommendation. We invite you to follow us on various social media apps, mainly Facebook and YouTube, but also Instagram and LinkedIn. Our goal is to treat you like family. These are 2 sets of Heather's parents. Mine live in San Antonio, or else they would have gotten into the pictures as well. But our parents are also our clients. My mom and my stepdad, Heather's dad, and stepmom, and her mother-in-law and father-in-law, and then Kim's dad. They're all our clients. And we make recommendations, like I said earlier, based on everyone's individual needs. And we only recommend plans we would be comfortable putting our own family into. So let me explain quickly why working with brokers like us makes sense. First and foremost, there are no fees to you. You don't pay us anything for our help. Our service is built into the Medicare system, so you get guidance without an extra bill. Second, it's the same plan whether you use us or not. Medicare plans are priced the same. Using a broker does not make your premium higher. You're paying the same amount either way, so you might as well have some professional help. Third, we're paid by the insurance companies, not by you. That's how it's structured. It allows us to help you compare and enroll without having to write a check for advice. Fourth, we give you access to multiple carriers. We're not tied to just one company. And I think this is the most important aspect of why you want to work with a broker. It means that we can look across different insurers and plan options and find the plan that fits well for you instead of trying to fit you into a single box. And finally, our recommendations, like I mentioned, are based upon your needs, not commissions. We look at your doctors, your medications, your budget, and how you actually use healthcare. The goal is to match you to a plan that makes sense for you, not to push a particular company. Okay, so we're going to go ahead and jump right on into the topic of original Medicare. This is the foundation of Medicare. So Part A and Part B make up original or traditional Medicare. If you have a red, white, and blue Medicare card, Part A is your hospital coverage and Part B is your doctor and outpatient coverage. If you have an inpatient hospital stay, that's going to fall under Medicare Part A. If you have a doctor or outpatient services, that's Medicare Part B. There is no monthly premium for Medicare Part A as long as you worked your 40 quarters or your spouse worked 40 quarters. The standard Medicare Part B premium is $202.90, $202.90 per month, and that's what almost everyone pays per month to have Medicare Part B. If you're taking notes and writing things down, you're going to want to write down that number, $202.90 in 2026. You could pay less if you receive extra help or Medicaid benefits, or you could pay more if you have a higher income. We're going to go into that detail right now. So IRMA, some people have to pay a higher Medicare Part B premium due to having a higher income, and that's IRMA, Income Related Monthly Adjustment Amount. IRMA is determined by your modified adjusted gross income from 2 years ago. So for 2026, they're looking at your 2024 income. If you are subject to IRMA, they will add that amount on top of your standard Medicare Part B premium. There's also Part D, drug IRMA as well. There are ways to appeal the IRMA determination. So if you're concerned about having to pay IRMA, or if you're concerned about having to pay IRMA, but you might want to appeal that, then that's something that we can talk to you about on our one-on-one phone call. So there are 3 main enrollment scenarios when it comes to Medicare. So all of y'all are probably going to fit within these 3 scenarios. What I urge you to do on paper is identify which enrollment scenario applies to you. It's either going to be 1, 2, or 3, and I'm going to break each of these down. Scenario 1, you currently receive your Social Security benefits. Scenario 2, you're not currently receiving Social Security benefits. And scenario 3, you have insurance through yours or your spouse's employer. So either scenario 1, 2, or 3. Scenario 1, if you are currently receiving Social Security benefits, then you're going to automatically be enrolled into Medicare Part A and Part B. And you will receive your Medicare card about 3.5 months before the month of your birthday. Your Part B premium will be taken out of your Social Security check automatically. If you're not receiving Social Security benefits, then you'll need to physically apply for your Medicare benefits. There are a couple ways to do that. The easiest way is online. If you run into issues or need help, we'll be happy to help and discuss that further on our one-on-one phone call. And then scenario 3, if you're still working and are covered through your employer plan, we're going to want to compare your employer plan side by side with your Medicare options to see which one is the best for you. Sometimes people don't realize that you can stay working, or your spouse can stay working and still switch over to Medicare. Many times Medicare options will be cheaper than employer plans, but this is very individualized, and we'll need to discuss your specific scenario on our one-on-one call. If you decide to stay on your employer coverage, then you can delay your Medicare Part B until you retire and want to go on to Medicare. If you're turning 65, your Medicare begins on the first of the month of your birthday, unless you were born on the first of the month. Then it starts the first of the month before your birthday. So you've probably heard that if you don't apply for Medicare when you're first eligible, then you'll be penalized. And well, that can be true, but most people, if they delay their Medicare, it's because they chose to stay on employer coverage, either through yourself or your spouse's employer. So there is one huge exception to that penalty. If you have creditable coverage through an employer, then you will not pay a late enrollment penalty for delaying Medicare. I've heard horror stories of people enrolling into Medicare Part A and Part B and keeping their employer insurance, and then they're basically paying for two insurances for no reason. You're either going to go on to Medicare A and B, or you're going to stay on employer coverage. You're not typically doing both. So I want you to book a one-on-one call with us if you decide, if you need help trying to decide if you should stay on your employer coverage or switch over to Medicare when you're eligible for it. Okay, so let's get into some major exposures of Medicare. So as you're writing things down, this is where I get a little bit more detailed, but I promise I'll keep it as simple as possible. So if you just have original Medicare Part A and Part B and nothing else, no other insurance, these are some of the costs. Your first exposure is the hospital deductible of $1,736 for the hospital stay. Day one, that deductible will be charged, and then there is an additional copayment per day depending on how long you're in the hospital. Part B, doctors and outpatient services, you're responsible for the first $283 deductible, and then a 20% coinsurance of all of the bills on top of that. And there is no maximum to what you can owe. That 20% keeps accruing and accruing and accruing. There is no limit or no cap on original Medicare costs just by itself. So my example of that is our agency has a client out in Beaumont. When she turned 65, she had just Medicare by itself. She ended up going into the hospital for 90 days due to a serious heart condition. Her total bills were about $400,000, and once all was said and done, she ended up owing about $30,000 of that on Medicare. Because you're paying that 20% of everything, right? 20% of every doctor that sees you, every test they run, every anesthesia they give you, Band-Aid they give you. So that can really start to add up. You know, Medicare is pretty good about covering most of your medical needs, but there are some major exposures that you do have on original Medicare. Or really any insurance in general. A lot of your employer insurances don't cover these things either. So these areas, or these are, excuse me. So these are areas where Medicare does not provide coverage, and they can significantly impact your finances if not addressed. First, prescription drugs. Medicare does not automatically cover medications. You need a separate plan to handle these costs, and we'll talk about that more in just a few minutes. Second, routine dental, vision, and hearing care are not covered. This includes cleanings, glasses, hearing aids, all which can add up over time. And then finally, think about long-term care needs. Medicare doesn't cover extended nursing home stays or custodial care. Plus, most care outside the US and even non-medical needs like groceries and housekeeping aren't included. Addressing these exposures with additional plans is essential for comprehensive coverage, and we're going to explore those options next. So we here at Bonnecamp Senior Solutions always recommend umbrella coverage to protect you from these exposures. Each umbrella plan is crafted to cover key areas that original Medicare might miss, offering peace of mind and broader coverage. These plans can be customized to your needs and budget, but no matter what Medicare plan you pick, we're always going to recommend some level of umbrella coverage. So, in order to protect ourselves from those exposures on original Medicare, we need to pick up either a Medicare Supplement plan or a Medicare Advantage plan. Many of you have probably heard about these options, but are confused and are getting bombarded with mailings and phone calls and advertisements, all trying to get you to sign up for their plan. We're going to break down each of these options so that you understand what your options are and so that you get an idea of which one would work best for you. In my opinion, this is where 99% of the confusion about Medicare comes in, so let's get to it. Okay, so here's a really good spot to go ahead and continue taking notes. So again, there are only two options available to you to protect yourself further than Medicare. Option one is original Medicare with a Medicare Supplement plan, also known as a Medigap plan, and then you're going to need to pick up a Part D prescription drug plan as well. Option two is a Medicare Advantage plan, also known as Medicare Part C. Medicare Advantage plans are offered by private insurance companies and offer all of the same benefits that you get on original Medicare. They often include prescription drug coverage built into the plan and many times come with extras above and beyond what Medicare covers, like dental, vision, hearing, gym memberships, etc. We are brokers and represent both of these options. There is no one size fits all. There are pros and cons to both, and we're here to help guide you on deciding which option works best for you. Okay, so we're going to focus on option one first, the Medicare Supplement plan. Medicare Supplement plans are a popular choice for many because of its flexibility and extensive coverage. Here are the key points to remember. First, the cost. You'll pay your Medicare Part B premium, which is $202.90, plus you're going to have a separate premium for the cost of your supplement plan. The premiums are individualized, so your prices may vary. We have to get you an exact quote. So when it comes to coverage, you'll have little or no out-of-pocket costs when visiting doctors or hospitals. This is one of the main advantages, offering peace of mind and financial predictability, which means when you go to the doctor or the hospital, it depends which supplement you get, but you're probably not going to pay a bill or a copayment when you have those services rendered. Most or all of it is going to be covered by the monthly premiums that you pay on your supplement plan. Another highlight of Medicare Supplement is the network flexibility. You can choose any doctor contracted with Medicare in the US without needing a referral. There are no networks on Medicare Supplement plans. Supplement plans, as well as Medicare, do not cover Part D prescription drug plans, so you'll need to buy a separate Part D plan. Also, it's important to note that extras like dental, vision, hearing are not included, so you would need to purchase separate plans for those as well. Your eligibility for supplements, they typically require medical underwriting. You have to answer health questions and you have to pass those health questions in order to get onto a supplement plan, unless you're in your open enrollment period or qualify for guaranteed issue. Open enrollment period is when you're first turning 65 or coming off of employer or first signing up for Part B. Guaranteed issue is when you're coming off of employer coverage. There are some other scenarios that qualify for guaranteed issue, but that's the most common one. So since everyone on this call is probably getting ready to turn 65, you're in your open enrollment period and will not need to answer medical questions at this time. Remember, the best time to enroll is 6 months prior to your birthday. This is going to help you secure the cheapest rates and make sure that you avoid any mistakes. Waiting until the last minute is never advisable. So Plan G, we're going to talk about that in a little bit more detail, but Plan G is the most common supplement plan. There are lots of different letters. There's an N, there's a high deductible G, there's a K, there's an A, there's a C. It gets very, very alphabet soup, but Plan G is the most common of them all. And the way Plan G works is that you're going to pay your monthly premium for the plan, which averages, again, it depends on your zip code, if you're male, female, use tobacco products. So we'll have to get you an exact quote, but about $150 to $200 per month, in addition to your Medicare Part B premium. And then your only other out-of-pocket costs for your Plan G is the Part B deductible, which for this year is $283. So you'll pay the first $283 of your Part B costs, and then after that, you pay nothing else out of pocket. Your Plan G is going to pay for that, as long as they're Medicare approved expenses, which again, we're going to talk more about things that are not covered by Medicare in just a little bit. Okay, so just to wrap up Medicare supplement plans, you're going to have original Medicare A and B. You're going to pay your Medicare Part B premium. You'll have your supplement, which is probably going to be Plan G, and that averages about $175 a month. And then you'll have your Part D prescription drug plan, which in our area averages about $50 a month. Some are more expensive than that, some are less, but we have to look at your individual needs in order for me to know what recommendation to make for you. We'll also be then adding one of the umbrella packages to these options, and then you'll be fully covered and ready to go. Okay, let's focus in on Medicare Advantage, option 2. Medicare Advantage plans, also known as Plan C, are run by private insurance companies. Most of them include Part D prescription drug coverage and have extras above and beyond what Medicare covers, like dental, vision, hearing benefits, gym memberships, etc. Most plans are a 0 monthly plan premium, but you will still pay your Medicare Part B premium. You're also going to pay co-payments, deductibles, and co-insurance for your medical care. All plans have a maximum out-of-pocket amount, which means unlike original Medicare, there is a cap to what you could owe in a calendar year. We will personalize an umbrella package for you based upon which Medicare Advantage plan you pick, so that we make sure to fully fill any gaps in coverage. As we dive into Medicare Advantage plans, we do want to talk about some of the networks. So Medicare Advantage plans are network-based, and they're typically HMOs and PPOs. Let's start with Health Maintenance Organization, or HMOs. With HMOs, you must use a network of doctors and hospitals. This means you'll need to designate a primary care physician and obtain referrals for specialists. The advantage, typically, HMOs offer lower premiums and out-of-pocket costs, making them an attractive choice if you're looking to save on healthcare expenses. Plus, they often include extra benefits like dental, vision, and gym memberships. Now, let's move on to preferred provider organizations, or PPOs. PPOs provide greater flexibility. There's no need for primary care physician, and referrals are not required. This flexibility can mean higher premiums and out-of-pocket costs, but PPOs often have nationwide networks and cover out-of-network services, albeit at a higher cost. Both plan types generally offer worldwide emergency coverage, but remember, the level of extra benefits can differ. HMOs usually offer more extras compared to PPOs. So to summarize, neither one of these is better or worse than the other. People often ask me which one of these is better, an HMO or PPO. Again, they both have their pros and their cons. HMOs are typically more suitable for individuals who prefer lower costs, more extra benefits, and are comfortable staying within a network of providers. PPOs are better for those who value flexibility and are willing to get less of the extra benefits and are willing to pay higher out of pocket costs for more flexibility in providers. Again, neither one of those, in my opinion, is right or wrong. It's really just going to depend on which one is the better fit for you. Okay, so how and when can you sign up for a Medicare Advantage plan? And you can do that as early as 3 months before you turn 65. And then you'll be able to make changes to your plan during the annual enrollment period, which is October 15th through December 7th. So here in the Houston area alone, we have close to 100 different Medicare Advantage plans that somebody that lives in Harris County is eligible to enroll into. And there is no way, well, I mean, maybe you could try for you to sit there with summary of benefits and start lining up all of the plans and understanding the differences between them. So this is where we come in. And how do we narrow down your plan options? First thing we're going to do is ask you for a list of the doctors you see, prescriptions, hospital you prefer, and any preferred pharmacies. We're going to run that information in our plan comparison software, and then we're going to present the plan options available to you. We'll then enroll you into the plan of your choice. You can make changes to your Part D drug coverage and to your Medicare Advantage plan option every year through during the annual enrollment period, and we are here to help you with that year after year. So we're going to take all of the information about your insurance that's most important to you. We're going to funnel that. We're going to narrow that down for you. That way you're not bombarded with too many options, and we're going to present those options to you. Okay, let's talk a little bit about Part D prescription drug coverage. So there are 3 phases to your Part D prescription drug coverage, and what we're about to go over applies no matter how you get your Part D coverage, whether you are purchasing a Part D plan in addition to your supplement, or if you're getting your Part D coverage built into your Medicare Advantage plan, this all still applies. The first phase of your prescription drug coverage is a deductible phase. A deductible is an amount that you have to pay first before your insurance pays anything. If your plan has a deductible, you have to pay that first. Once you've met the deductible, or once maybe your prescriptions are not subject to the deductible, then you move into the initial coverage stage. The initial coverage stage is when you're either going to pay a flat rate copayment or a coinsurance, which is a percentage of the cost of your prescriptions when you get them filled. These amounts that you owe are determined by your plan's formulary, and not all of the plans have the same formulary. In fact, they all have very different formularies, which is why we need a list of your prescription drugs in order to help make a recommendation for a plan for you. Now in 2026, all Medicare Part D prescription drug plans have a maximum out-of-pocket, a true out-of-pocket cost of $2,100, which means no matter what plan I have you on or what prescriptions you're taking, as long as they're on the formulary and covered by the plan, you will not pay more than $2,100 for the year for the cost of your drugs. And that does include any deductible you might have paid as well. If you reach the $2,100 true out-of-pocket max, then you move into the final phase, which is catastrophic phase of your prescription drug coverage. At that point, you no longer pay anything towards your prescriptions for the rest of the year. They are covered in full by your insurance. Again, this information on this slide applies to all Part D drug plans. Part D penalty. So one thing you need to be aware of is if you don't get Medicare Part D prescription drug coverage when you're first eligible, and you don't have creditable coverage through an employer or VA, for example, you will accrue a penalty for not having drug coverage, and you will have to pay that penalty for life. We are always going to recommend Part D drug coverage unless you have other coverage like employer insurance or VA benefits. So we're always going to recommend you have Part D drug coverage, even if you don't take prescriptions, because first of all, you need insurance in case you need to take prescriptions, but also we want to make sure that you avoid that penalty. So what's our process to recommend a Part D plan? It's very similar to our process to recommend a Medicare Advantage plan. We're going to ask you for a list of all of your prescriptions. We're going to ask, what your preferred pharmacies are. We're going to compare all the Part D prescription drug plans available to you in your zip code. We're going to make the recommendation and help you enroll into that Part D plan. And then we're going to reevaluate that Part D drug coverage every year, annual enrollment period, October 15th through December 7th. Okay, so I just want to go back and recap the difference between a Medicare Supplement plan and a Medicare Advantage plan. This is, again, where 99% of the confusion of Medicare comes in. And as you're transitioning over to Medicare, this is going to be the first decision you need to make. Are you more interested in a Medicare Supplement plan or a Medicare Advantage plan? From there, we can start kind of honing in on your plan options once we know which direction you want to go. So with Medicare Supplements, you have the freedom to see any doctor nationwide who accepts Medicare. This plan is ideal for frequent travelers frequent travelers or those who's with ongoing health issues who value predictable, low out-of-pocket costs and stable benefits. However, keep in mind, this comes with higher monthly premiums and doesn't include drug coverage, so adding a Part D plan is necessary. Now, let's look at Medicare Advantage. It often comes with a low or no monthly premium and typically includes extras like drugs, dental, vision, and hearing coverage, all wrapped into one card. This plan is great for those on a budget or who enjoy bundled services. However, it's important to note the network restrictions, potential need for referrals, and possible yearly changes on the plan. Ultimately, the best choice depends on your personal needs and preferences, whether you prioritize flexibility or more comprehensive coverage at a lower cost. Again, neither one of these is right or wrong. Neither one of these is the best. It all is just going to depend on what works better for you. We kind of talked earlier, there are some major exposures of Medicare, and like I said, we need to add umbrella coverage. So no matter if you're going to pick a Medicare Advantage plan or Medicare Supplement, or maybe you're going to decide to stay on your employer insurance for a while, you still have exposures that we need to go ahead and fill now by these umbrella coverages. So one of the first big exposures is critical illness or cancer, heart attack, and stroke coverage. Unfortunately, 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime, and every 40 seconds, someone in the US has a heart attack. We are always going to recommend critical illness coverage for every Medicare beneficiary and honestly for every person, even if you stay on employer insurance. I have a cancer, heart attack, and stroke plan on myself. And that is because you will have out-of-pocket expenses if you're diagnosed with cancer or have a heart attack or stroke that Medicare doesn't cover. And the amount's going to vary, depending on diagnosis or treatment plan, but you're going to want help paying for the things that health insurance and Medicare doesn't cover because it does add up. Your next one, the next big exposure will be skilled nursing coverage. This is where the biggest exposure of Medicare lies. Medicare does not cover nursing home care or home care beyond what is deemed medically necessary. If you need care for an extended amount of time, Medicare will not cover that. Medicare does not cover long-term care. And you could end up draining all of your assets, everything you worked for. So what we need to know here is original Medicare and Medicare Advantage will only cover days 1 through 20 of skilled nursing care. Most options will cover these at a zero copayment for days 1 through 20, as long as you have a 3-day hospital stay inpatient before you go to skilled nursing. And in order to keep staying there, you have to be improving. That's the big one there. You have to be improving in order to get the full 20 days. Now, going into days 21 through 100, depending on your plan, you could have a copayment of up to $200, $250 a day, up to your annual maximum out-of-pocket amount on your plan. However, the biggest thing I want you to take note of is that after day 100, there is absolutely nothing that Medicare covers. You are responsible for all costs. Also, your doctor or healthcare provider may recommend services more often than what Medicare covers, and they may recommend something Medicare doesn't cover at all. So if you don't have a plan in place, or if you don't have some type of assets, this could be a huge exposure. So there are two options here. One, you have a plan in place and we're going to help you with that. Or two, you self-pay. You use your 401k or other retirement nest egg, or even your house as a Medicaid spin down to pay the full costs. I think we all know which option we would rather have, and it's going to be getting you on a plan. So this is just quickly straight from the Medicare and You book, just showing you that in order to have a Medicare approved skilled nursing stay, you have to have been in the hospital as an inpatient for 3 days, and you have to be improving. Okay, coming into the home stretch. So as we wrap this up, we know that a lot of people making the transition onto Medicare are also transitioning their financial lives as well. We know that a lot of people have either an employer plan or market-driven accounts, such as liquid accounts on these screens. If you're looking for a way to keep your retirement savings protected from market downturns while still having the potential for steady growth, there are solutions designed to do just that. They can provide lifetime income that you can't outlive, help protect your principal, and still give you opportunities to see your money grow over time without the full risk of the stock market. While I focus on Medicare and health coverage, I can refer you to our financial services team that specialize on retirement funds, and they deal with protection. The retirement funds that they deal with focus on principal protection and safe money in retirement. And together, we can make sure that your healthcare and financial strategies align. So if you're needing help with the financial transition you are making at this time in your life, please let us know on our call and we'll set you up with a meeting with them. Okay, so that's it. We made it. You have completed phase 1 of your Medicare education. Thank you so much for spending your time with me today. The next phase is for you to schedule your free consultation with us so that we can talk with you one-on-one about your specific scenario and your needs. You'll just want to click on the calendar link and schedule that call. After the call, we'll send you your personalized Medicare roadmap and cost summary so you know fully what to expect for your cost. Phase 3, once you're our client, you get free lifetime support and customer service. Again, our goal is to help you find the plan that fits best for you and that you're happy with us, you're happy with our services, you stick with us year after year, and you refer us to your friends and your family. That's how we grow our business. We're here to help you year after year as your plans change or as your medical needs change, and we'll continue to keep you informed of any changes in the future. And then again, just to reiterate, the next step is to schedule your personalized one-on-one call. We only have a limited number per week of these calls because we do these webinars on a weekly basis. And we really try to keep some of the schedule open to make sure that the people who actually want their help or want our help, we have time available to help you. So go ahead and schedule that right away before the spots fill up. And again, thank you so much for spending your time with us. We look forward to helping you with your Medicare options, and we'll talk to you soon. Bye.